I am Dr. Amol Rangnekar, transplant hepatologist at MedStar Georgetown University Hospital. I see adult patients with all types of liver disease, including kind of short-term or long-term liver diseases, all the way up to more advanced liver problems such as cirrhosis or even certain cancers in the liver. I see adult patients of all ages, all the way from 18 to currently 95. I think that my philosophy of care is the importance of shared decision-making. I think that in addition to telling patients what to do, it's equally important to educate them about their diagnosis, go over what their treatment options are, and explain what the risks and benefits are specifically. It can be pretty difficult for some of our patients when they receive scary diagnoses, whether we're talking about their need for a liver transplant or it's a new diagnosis of cancer. I think in most cases, patients need a couple of things. One is reassurance. They need to know that things are going to be okay, that they need to focus on themselves, look at the short term, and that we'll worry about everything else afterward. And I think the other part is that most people lose control when they hear bad news. And so one of the more important things I can do is give them a discrete plan and tell them what exactly we're going to do and when. Unfortunately, in the US, there are more people who need liver transplants than there are livers available for them. This has really made it important that we try to figure out other avenues to get livers for patients who really need them. One way to do this is actually through living donation. That's where we can get a portion of a liver from someone who's healthy and put it into somebody who's very sick with advanced cirrhosis. By having living donors available, that reduces the number of other patients who are waiting for deceased donor organs and make sure that we transplant more patients overall. I think that the future of transplant hepatology is bright. We have evolving and new medications for a variety of liver diseases that haven't really changed over years beforehand. We also have all kinds of new ways to offer transplants to patients, whether that's living donor liver transplants or even certain types of preservation systems to maintain deceased donor livers for a longer period of time so that we're able to get more livers for more patients. What I love most about my job is taking care of people over a long period of time. Sometimes I meet people very early on, right when they first are diagnosed with a liver disease, and then we were able to start them on treatment and get them much better right away. Unfortunately, in other cases, I meet people when they're much farther along in their journey where they have more advanced liver problems. And sometimes it's very difficult to recognize them at that point. They've been sick for so long. I'm often surprised to see patients after their liver transplants. Sometimes I walk right by somebody in the waiting room and I don't recognize them at all because I've seen them at their worst. And it's really rewarding to kind of see them back to normal again. We treat a variety of conditions that includes anything from all sorts of chronic liver diseases such as viral diseases like hepatitis B or C, alcoholic liver disease, and even autoimmune liver diseases. We take care of patients who have more advanced liver problems such as cirrhosis. Some of those patients may need liver transplants. We also see patients who have a variety of cancers in the liver. And then finally, I have the opportunity to take care of patients after they've had liver transplants. So we're involved in a lot of different research studies at the current time. I think some of my main areas of focus include alcoholic liver disease. In particular, we are involved in a long-term study with other large transplant centers where we're looking at patients before and after they've had liver transplants, and specifically patients who've suffered from alcoholic liver disease. Our hope from this research is to kind of figure out more about what to do for these patients before the transplant, and then if there are specific things that we should do to optimize their long-term outcomes after the transplant as well. A second study that we're just starting right now is to look at the role of frailty in patients with liver transplant. In other words, see if there's other ways that we can get them in better shape before they go through such a major surgery, whether that requires their nutritional status to be optimized or whether they need more simple things, even just like physical therapy, to get them stronger. So patients who have more advanced liver failure, such as patients with cirrhosis, can present with a variety of different signs and symptoms. The most common things that we see include jaundice, which is yellowing of the eyes or skin, fluid buildup, whether it's in the abdomen or swelling in the legs, bleeding in the gastrointestinal tract, or sometimes confusion because there are bad things that can build up in the blood, such as ammonia, and affect people's thinking. So we use a variety of tests to arrive at a diagnosis for a patient. That can include anything as simple as blood testing, a variety of imaging tests, whether that includes ultrasounds or CAT scans or MRIs. Some patients that we see do require endoscopic procedures, whether that's an upper endoscopy or colonoscopy. And then finally, some patients require surgery or liver transplants, and those are patients that we share with our liver transplant surgery colleagues. One of the best parts of my job is that we really work in a multidisciplinary fashion in liver transplant. When patients come in to be valued for liver transplant, they're initially seen by someone like me, who's a hepatologist, but then they're seen by one of our transplant surgeons. They're seen by an anesthesiologist to make sure that they're safe to undergo surgery. They're seen by a variety of our nurses who are coordinators specialized in transplant. We also work with other folks, including social workers. We work with dietitians, physical therapists, and even financial coordinators. So it takes a lot of team members to make things run here. I believe that patients should choose MedStar Georgetown Transplant Institute because we really do work in a multidisciplinary fashion. When patients come to see me, I'm happy to provide my opinion, but I'm also humble enough to know that I don't always know all the answers. And so sometimes that requires me to look into something in more detail. Sometimes that requires me to talk with my other colleagues. And I think we do that a fair amount, whether that's at formal meetings or even informally on a day-to-day basis. I think the most common question that I get from most patients is, am I going to be okay? And once again, I think that the most important thing for me to do is provide reassurance. And I think in most cases, people will be okay. They may not be okay immediately. And so what's really important is to kind of talk through what do they have, what are we going to do next, and what's the timeline until they get back to being normal again. In addition to my regular job caring for patients with liver disease, I'm actually the medical director for a living donor liver transplant here at Georgetown, so I do have the privilege of taking care of and seeing many of our living donors. I'm also in charge of the Transplant Hepatology Fellowship Training Program, so I have a hand in the training of the next generation of liver specialists.